There's a problem in health research in that it tends to exclude people from certain communities and therefore exacerbate pre-existing health inequalities. So at the Deep End Research Alliance, we try and address this by working with people from ethnic minority communities and socioeconomically deprived communities to ensure that they're fully engaged in the research process from the very beginning.
The Chinese Community Centre started working with the Deep End project from the University of Sheffield. We began with a brain health project. The experience was so different to the way we've had to work with other projects in the past. The difference is this project have actually approached the Chinese community with an open mind, and they looked to the Chinese community and worked with the members to see what they wanted.
SACMA has been working with the Deep End Research Alliance for a number of years now. I think the first piece of research that we did was around prostate cancer. That research led to the formation of the first black men support group in the North around prostate cancer. The University of Sheffield, I think, is one of the organisations that has done most to work ethically. As each research project has come to the organisation, has gone on, we've got slicker, if you like, in terms of how we address the challenges. And we've had good, robust conversations about how people who are sharing their lived experience should be valued, how the organisation that is coordinating the research should be valued, how we work together in a real partnership that isn't just the university coming away with a good piece of research for publicity, but a research that will impact and make a difference in the lives of the community, but also in the lives of the organisation.
The challenges that we came across was when we were trying to invite community members to join the Brain Health Talk. Community members already had an idea because of the past 15, 20 years of experience from other research projects. Community members came into the community centre expecting to just sit there and listen, and that would be it. The Deep End project would just leave and we wouldn't hear from them again. Quite often in the past, we have been given a subject that researchers wanted to interview members about, and then Deep End comes along and turns it all the other way around in terms of respect, in terms of actually listening to the community, in terms of actually giving the community feedback. After the 2 focus groups of discussions around brain health and dementia, the community group then asked, what next? We want to continue to be involved, and that was so refreshing to see. They were eager to help the project.
Community research link workers began life as community researchers, and so we undertook a piece of research that was commissioned by Sheffield Health Watch around a review of home care services in Sheffield City Council, and we used 2 members of the community who were in the role of community researcher, and the only ask of them was that they have good, robust links into the community, and that they were able to, with support, to produce a report at the end of it. And that model of working has really become the kind of go-to model for community research, generally speaking.
The crucial part here is that the research link workers within community settings already have that trust. They have the skill set, they have the experience, they have the know-how, they have the knowledge, they understand their own community. It is a more direct way of accessing information that could truly represent certain communities that the research project is trying to represent. Research projects that work with communities need to understand them from the heart, and that's what we're here for. By being represented, it means that one day these projects and their results will be used, and if we are to be included in service provision and service improvements, we need to be involved in research projects.